let everybody in.
Hi, everyone. Welcome to the Advocacy 101 training. I see people are getting connected right now. If you all notice that your name is Angela Cooper on the little webcam thing, you can actually change your name. That probably just means that you use the link that Angela sent out, but you are able to change your name if you would like to. And it would be nice so that we know who all is in the room and can have conversations and whatnot. Let us know if you all have questions. You can drop any questions that you have about how to do that in the chat. And just so everyone is aware too, this session will be, or is being recorded. I'm gonna go ahead and introduce myself just to be mindful of time so we can make the most out of this training. My name is Celine Mutuye Maria. I am a community health worker at Shawnee Christian Healthcare Center. My title right now here is Community Health Coordinator. And one of the goals that I had in my CHW work this year was talking to my fellow CHWs about navigating housing and how we can better support our clients and also amplify their voices to get their experiences with navigating housing out there so that we can come up with better solutions that are truly led by the community. I don't know about you all, but oftentimes when I'm asked about help with housing, I only know the limited amount of options, and none of those options are immediate for those who need emergency or rapid rehousing. So a lot of what this campaign will do will highlight programs that exist, what's working, and then eventually our ultimate goal that we discussed back in May would be to work on potentially creating some sort of bill or proposing some sort of legislation around housing for health as a basic human right. And so we have worked with Kentucky Voices for Health to bring this training together. And as far as updates on where we're at with the campaign before we kind of jump into the training, this training is kind of providing kind of a baseline education around the work of advocacy and will help us really to form our campaign and to make sure that we're mindful of different aspects of building a campaign and advocating for clients. And so right now, where I'm at is that I've had several meetings with various individuals who work on housing in Louisville, the Office of Housing with Louisville Metro. I met with them. I've met with Coalition for the Homeless. I'm also working on meeting with New Directions Housing Corporation, hopefully by next week, and then coming up with a report about all of the information that I found, which will hopefully help us identify certain workshops and other continuing education and actions that we can do around this Housing for Health campaign. My goal is to get you all that report before the end of the month, and then so we can move forward with planning for the campaign. So we're really in the planning phases right now. So feel free to email me if you have any questions, or you can ask me during this training, and I will hand it over to Emily now to introduce our speaker.
Great, thank you so much, Celine. Just say that I'm Emily Beauregard. I'm the director of Kentucky Voices for Health. I'm also a member of the Thrive Kentucky campaign. And we were just really delighted to be invited to the May meeting to talk with CHWs in Louisville about a Housing for Health campaign. We believe, that housing is absolutely essential to health, as are many other things such as food and healthcare and, just the basic needs that people have to be able to be healthy, to take care of their families, and to thrive. We want to make sure that we have policies in Kentucky that allow every Kentuckian to thrive. And so our Thrive Kentucky campaign is focused on really finding what those policies are and then advocating for them primarily at the state level. But we like to work with advocates from all over the state. And when we find groups like the CHW group in Louisville who are interested in these similar issues, it's a great opportunity to collaborate and to have power in those numbers, having more people, especially people who are on the ground who see this, see both the struggles that people have every day, you know, where our policies aren't working, where they fall apart, where people fall through the cracks of our social safety net. And then also, I think that community health workers often know what the solutions are, what people need, and how to help people get those needs met in order to thrive. And so we're just delighted to be able to do the training. This is a training that we have done for a number of groups over the years. And Dr. Sheila Schuster is our, what we call grandmother of advocacy. She created this training many years ago and has been refining it and tailors it to the needs of different groups. But it really is a 101 in the way that Celine said, which basically it's the type of training that kind of helps you understand what the ropes are, you know, how legislative advocacy works, how advocacy on more of the regulatory side, the executive branch works, and what your role can be in advocating both at a local and a state level. And so I'm going to just introduce Sheila and then do a little bit of housekeeping. And actually, maybe I'll start with the housekeeping first. I think everyone kind of knows these ropes by now, but we do have a number of people on the webinar today, and so we want to make sure everyone stays muted unless you're planning to speak. You can actually drop any questions or comments in the chat box, and we're going to be checking that throughout, and Sheila can address those as we're going. We will be recording this. It's recording right now, and so we'll be sending out the slide deck and the recording probably tomorrow as a follow-up, and then any materials that Sheila wants to share. And so you'll have those. And finally, I think everyone is aware that we are providing CE credit for certified community health workers, so we're very excited to be able to do that. And if you're interested in getting CE credit, you can send an email to Angela Cooper to complete that process. Angela, if you don't mind putting your email address in the chat box, we'll be sharing that again at the end of the presentation. And then finally, I think Laura Eyrich is going to be sharing some state CHW updates at the very end of this presentation. So when Sheila's done, we'll have a few minutes for Laura to share any updates that she has. So with that, I want to introduce Dr. Sheila Schuster. For those of you who don't know her yet, she is not only the director of the Advocacy Action Network, but also the founding chair of Kentucky Voices for Health. And as I said, she is someone who has been doing advocacy for years. She's a licensed child psychologist with more than 30 years of experience working as a mental health and disabilities advocate in Frankfurt. And she has been doing these trainings for, I'm not exactly sure how long, Sheila, but I think she knows, she's found a way to develop advocates throughout Kentucky, and she's showed a lot of us what the ropes are, and has really helped to create strong groups of advocates and coalitions like Kentucky Voices for Health for years now. And so this is something that we're excited to be doing with community health workers. We think community health workers are natural advocates, but knowing what some of the tools and strategies are is always helpful. And so I'm going to turn it over to Sheila now to tell you a little bit more about herself and get things started.
Thank you very much, Emily, and good morning to you all. I wish I were in a room where we could see each other, because I think it's so much easier to generate some enthusiasm when we're there in person and get to your questions right away. So I encourage you to use the chat box. If I mention something or talk about something and you want me to go back and clarify or give an example or whatever, don't hesitate to put it into the chat box. I am really excited to be talking to you this morning. As Emily said, I've been doing these advocacy trainings, I guess, easily for 20 years, if not more than that. And it just creates a lot of enthusiasm for me to be able to talk to people that are interested in advocacy. So I'm going to start with talking about what advocacy is and why I think that you want to be an advocate. And you may not be sure, but hopefully at the end of this, you'll be absolutely sure you want to be an advocate. So this is a picture of our state capitol, and we have 10,000 folks there who came to Frankfurt because they were advocates about an issue. And you can probably guess if I asked you, who do you think these folks are? The answer would be teachers. But this was not in the last couple of years when so many teachers were in the state capitol. This was in 2005 when there was a great threat of a decrease in funding for public education, and 10,000 teachers from all over the state descended on the Capitol. Teachers have a secret weapon that the rest of us don't have, which makes it easier for them to come to Frankfurt in huge numbers, and that is that they get their school superintendents to call off school, and then they commandeer the school buses and load them up with fellow teachers and family members and so forth. So most of us don't have access to that kind of transportation power. So one of the ways to do advocacy is in big numbers. And, if you look around, I was asking before, Celine and Bev, how many CHW workers there were and so forth. So you're, a hearty group of 130 or so. But you can magnify your voices to sound like you're 10,000. That's partly what I want to talk to you about today. And I'm also going to give you some examples of how a single voice can very often be the thing that pushes a bill over the line or stops a bad bill from happening. Next, Angela. So I want to remind you that a democracy requires that the voice of the people be heard. If we do not raise our voice, there is no democracy. This is a picture of one of the coalitions that I run. This is the 874K coalition. There are 874,000 Kentuckians who have a disability of one kind or another. So that includes physical disabilities, developmental and intellectual disabilities, mental illness, substance use disorders, acquired brain injuries, sensory disabilities. And very often people with disabilities feel like they are the most ignored, overlooked, and marginalized folks. And my job over the years, and this coalition is 20 years old, we celebrated our 20th anniversary this year in the Capitol with about 800 people with disabilities rallying in the Capitol, is to empower them to know that they have a voice and that they have a role in democracy. So I really encourage you to think about what your role is in terms of raising your voice. Next, Angela. So a reminder that policies will be made at all levels. So policies are made at the federal level. We know policies are made at the state and at the local level. And this is kind of my therapy slide as a psychologist. So if I were seeing you in therapy and you kept coming in week after week and telling me about the same situation that was really creating a problem for you time after time after time, at some point I'm going to say to you, you have to make a choice. Either you have to decide that you're going to be a victim of this situation, whatever it is, or that you're going to do something about it. And I'm not saying that we're the victims of policies, but we are the recipients of policies. And we can either decide and do whatever they want, it doesn't affect me, which is not true. System of policymaking, whether it's at the community level, whether it's about your clients or patients, whether it's about your profession as a CHW, whatever those issues are, that you can do something to influence that system. Next, Angela. So why me? Why you? Let's remember that all of our policymakers are elected by us. Whether you voted for them or not, they got into office as part of the election process. Therefore, they have a duty to serve you and to listen to you. Some of them do it better than others, quite frankly, but you have an absolute right as a constituent, meaning someone that lives in the district of the person that has been elected, to raise your voice to make sure that they hear what you have to say. I always say to people, you can't be mad at your policymakers. You can't be mad at your legislators or at the governor or at the Metro Council or whatever if they're not doing what you want them to do, if you've never told them what it is that you need for them to do. So you cannot hold them accountable unless you know you've done your role. This is a two-part role, if you will. You have a role as the voice of the people in the democracy. They have a role to be responsive to the voice of the people. So you've got to speak up in order for them to do what they're supposed to do. Next, Angela. So this is a little bit of this is my guilt slide. You know, if you don't speak out, who will? This is one of our 874K coalition rallies. We had about 1,000 people at the convention center when it was still in existence in Frankfurt. And we would have legislators come and address, and we would have the governor come and talk to people. And we would have people from the audience and selected people with disabilities come to the microphone to tell their story, what it was that had helped them live a better life, stay in the community, get an education, whatever those issues were, and what barriers were still there. So I think that you all have an incredible amount of knowledge. You know your community, you know the things that get in the way of your clients having everything that they need. You've identified, and I know this from our May meeting, that housing is a huge problem. So who knows better to speak up about those issues than you do? You know it from your client's point of view. You also know it from your work in the community. So you all are the ultimate grassroots kinds of spokespeople. You really have a powerful voice to tell the policymakers what's going on in the community, what needs to be changed. Next, Angela. So why should that voice be yours? I'm going to assume that you didn't get into being a community health worker unless you really cared about the people. You know, you can't do the kind of work that you're doing without having a lot of passion about it and caring. You're knowledgeable about your issues, and Celine's a great example. If you don't know everything you need to know about, for instance, the housing issue, you're going to reach out and talk to the people that know, and then bring that information back and share it with the rest of you. And you're also willing and able to share with others what you know and experience. So in many ways, that's what you did when you invited KBH to your May meeting. You reached out to us and said, we think you have some information that we need. We think we have some information that we want to bring you into the picture so that we can tell you how much of a problem housing is and how we want to make housing part of our health initiative. Next, please. So my definition of advocacy is that it's education with passion. I can't make you be passionate about anything. I have things that I'm very passionate about. Mental health, obviously, because I'm a psychologist and I was in practice for so many years. People not having access to healthcare, people being treated badly for whatever reason, just really gets my juices flowing. So you know what you have passion about, and you bring that passion to your work as an advocate. You can't be a CHW without having good listening skills. I know that when you're talking to your clients, when you're talking to people in the community, that you are listening for themes, you're listening for what the issues are. You're connecting. It's one of the things that you do that's part of your job description, so to speak, is to connect people that need services with people that give services and try to bridge that gap. You're willing to speak up. You're willing to speak to your clients. You're willing to speak to the service providers. You're willing to speak to, hopefully, the policymakers, because you're in a position to say, you know what, there's a real gap here. We've got X number of people in these communities, and this is what they need. And we've exhausted all of our resources. There simply are no more resources to meet that need. And so I'm going to speak out about that, and I'm going to take action about that. So you're an advocate because you have passion either about a particular issue or about people, or in most cases, both, because they're really inextricably linked. Next, Angela. So again, advocacy can be focused at many different levels. I'm going to talk a lot about Frankfurt because I think it dictates so much what happens even at the local level, and because that's where I've spent the last 30 some odd years of my life trying to change policy. But you're really doing advocacy at the individual level when you help a community member overcome obstacles to get the services that they need. I say that to psychologists all the time. You're not just providing a psychological service. You need to be an advocate for your client. So if your client is in there to talk about their depression, and part of that is that they don't have quality, affordable housing, and that's contributing to their depression, then that's an issue that needs to be addressed. So your advocacy can also be at the local level, say with the Board of Health or with our Metro Council, can also be at the state level with the Kentucky legislature, and also on the executive branch side with regulations and working with the cabinet and the governor's office, or it can be with Congress in DC. Next, Angela. So we can focus on legislation, and we've talked about, Celine talked in her introduction about perhaps some legislation around housing. We can talk about regulations. Regulations are what put the legislation into place, what implements the legislation that's passed. We can also focus our advocacy on government action. So Thrive Kentucky, which Emily mentioned, has a monthly meeting with the Cabinet Secretary and the Cabinet for Health and Family Services, and with all of the departments that are there, like Medicaid, with Department for Community-Based Services and some of those subgroups, because they set policy. They don't have to pass it in legislation, but they send out information. They suggest changes in policy through regulation, and we want to be able to dialogue with them and give them some input from our perspective about what those policies should be. So you need to figure out what's the policy that needs to be changed to solve the problem. And it may be at several levels. In the housing, you know, one of the problems may be that there simply is not enough housing, period, that there simply are not enough housing units in this particular community or in this particular area. It may also be that there are regulations that stop available housing from being accessed by your clients. So there's another aspect that you can look at in terms of what is that policy, what's that regulation, what are the criteria that somebody has set about making that housing available, and what can we do to do something about that. Then you have to figure out who has the power to change it. And sometimes it is not easy to trace it back to where it started. And sometimes when you go to policymakers, they will kind of shift the blame or say, well, it's not us. It's kind of chase that down and make sure that you know where the change needs to happen. You need to figure out how you can be one of those people that policymakers listen to. And one of the ways that you do that is to put a face on the problem. We're going to talk about that. Have your facts, present them in a reasonable way, and never give up. Be persistent. It sometimes is that squeaky wheel over and over again that really gets the oil that's needed. Next, Angela.
Sheila, we have a question. Are community members' community input included when it comes to the regulation of policies after legislation passes?
Are they included in that process? Is that the question?
Yes.
Yeah. Yes, and we can talk a little bit about that. Impacting regulations is not as public as working with the General Assembly and the legislators. But yes, every regulation has to be promulgated or put out for public viewing in what's called the Administrative Register. And there is always a comment period of at least 30 days. They will have a hearing if you want them to have a hearing. I always say to people, don't bother to have a hearing. You can send your comments by email or by snail mail, and they'll tell you where to send them. And it has just as much weight if you send in your comments in writing as if you go actually to the hearing. So then they issue what they call a statement of consideration, where they have to respond to every comment that they get. So if Celine wants to raise a question about a regulation that she thinks is overly restrictive, and she says, I think the wording ought to be changed in section 2, line so-and-so for this reason, they have to, in their statement of consideration, say, Celine sent this in from Shawnee Health Center, and this is our response to it. We just had a huge victory on regulations where several of us, and over the years, Kentucky Voices for Health has urged the cabinet not to have copays for Medicaid services. So you would go in and they'd say, well, it's going to cost you $3 to get your prescription, or it's going to cost you $2 to see the doctor. And we think that's wrong. And we have argued about this for years. Well, we sent in our regulations once again, several of us. And when we got the statement of consideration back, it was like Christmas. We opened it up and it said, we heard from so-and-so and so-and-so and so-and-so that we should not have copays for these reasons. And so we are dropping all copays. So when this regulation goes through the rest of the process, there will no longer be copays in all of Medicaid, Medicaid under managed care and Medicaid under fee-for-service. So I felt like shooting off fireworks. You know, this was really a big, so yes, you can have that influence. You have to know the right people to keep an eye on the regs, because it's not as easy to follow as there's not a website for it like there is for legislation, and there's not a time frame for it like there is for legislation. You know, it's fairly public when the General Assembly is in session. Not, you know, regs can come 365 days a year, and you've got to just be on the lookout for them. But yes, absolutely, you can have a role in that.
Sheila, I just wanted to add one thing to that.
Yeah.
You know, KVH also collects public comments from the community. And I know Celine got more familiar with KVH when we were working on the Medicaid waiver, the 1115 waiver, Kentucky Health, that was created by the Bevin administration. And
right.
We were collecting thousands of public comments then. So if anyone on this call submitted comments or asked, you know, clients of yours or coworkers of yours, people in the community to submit comments, those were part of the public record. And those were cited by Judge Boasberg, who blocked the waiver 2 times in federal court. They were cited over 30 times, these public comments, in his opinion. So that's pretty unheard of. And
right.
It was really exciting to know that people's voices were being heard and making a difference in that way. And then with the copay regulation that Sheila mentioned, that regulation changed a number of times, and I think we went through like 2 or 3 public comment periods
Right.
Over the past 2 years. And we submitted hundreds of comments from, again, people who were directly affected by those copays. So we're not just submitting our own comments, we actually try to collect other comments. And it's great to have CHWs help us do that.
Yeah, and I would just add that we had a reg that very much affected people with serious mental illness. It was really an awful reg. And so I rounded up a bunch of people. We requested a public hearing because I wanted them to have the opportunity to actually make their statement, to really feel like they were adding to the record. And when you go to those public hearings, there aren't legislators there. There are a couple of cabinet people, and they have a court reporter, and they record what you say and so forth. But it was a wonderful first experience for many advocates who were scared to death, who had really worked hard on what they wanted to say and were nervous about it, about going up in this auditorium and standing at the microphone. And then afterwards, they said to me, when can we come back and do this again? So it was that real empowerment that is really what I want people to have, that sense that they've made a difference. They've raised their voice and it has made a difference. So you can act as an advocate, obviously, by your willingness to get involved because you're knowledgeable, because you provide accurate information. And I'm going to stop here for a minute because I think if I could ask each one of you, what's your reluctance in picking up the phone and calling your state representative or your state senator? And I suspect that many of you would say, well, I don't know that they would listen to me, or they would know who I was, or even if I knew what I wanted to say, I would be afraid they would ask me a question that I would know the answer to. And that does happen. It still happens to me after all these years of being in Frankfurt. I might have a meeting and feel like I know this issue frontwards and backwards, and a legislator will really throw me a curveball and ask a question that I literally just don't know the answer to, that actually is a wonderful opportunity for you to have a second bite at the apple, for you to say to that legislator or to that policymaker, you know, that's a great question and I don't know the answer to it. Do not pull an answer out of your left ear. You may be great at doing that and just kind of, what we say, BSing something, but you don't want to do that. You don't want to give possibly inaccurate or false information to somebody. So what you do want to say is, you know, that's a great question. Let me go back to my group and get the answer to that. How can I get in touch with you? What's the best way for me to reach you with that information? And very often the policymaker, the legislator will say, well, don't use the LRC state website, email address, because so many people use that. Here's a different email address you can use. A lot of times they'll say, here's my cell phone number. Celine?
Yeah, actually, it's funny that you brought up cell phone numbers. I had an experience in June where I was really getting more into community organizing in my own personal time. And I was learning more about the budget and city council and all of that type of stuff. And one of the people that I'm learning from had David James's number, who's the Metro Council president. Yeah. So she told me, call David James and tell him what you just told me. And I'm like, what do you mean call him? Just I could just call his cell phone and just talk to him. So it was really weird to me. And it just kind of highlighted how it's really not normalized, I guess, for many people, the fact that you can have conversations with representatives on Metro Council. And I'm learning more and more now how it is expected and natural, and people should be able to call Metro Council just like they would call anybody else that, you know, they wanted to be heard from. And so just I've been thinking a lot about now, like how, because even when I called, you know, I had the information that I wanted to share, but I was really nervous for some reason. And so just I think that kind of highlighted for me why some people just don't naturally think to do that, and how we can make that more of like a seamless, natural process. But it was an interesting experience recently to just know, like, yeah, you can literally call these individuals.
Right. Thank you for sharing that, because that really is the heart of this. Again, if your Metro Council people, if David James is the president, never hears from you about what your concerns are about the budget, then you can't hold them accountable for doing what you want them to do about the budget. And so you use the means that are available. Now, you didn't call them at midnight, and you didn't call them and cuss them out, and you didn't, you know, you did it in a polite way, I'm sure, and said, you know, I'm a constituent, I really want to talk to you about this. And very often they will give you their cell phone numbers. That's not, you know, that's not unusual these days.
And what ended up happening is we were actually invited to a meeting with some representatives after that conversation because of some things that were brought up. So that for me was the first experience of, oh, wow, this really works. They actually do want to hear from us, regardless of what happens with that feedback we give, but you know, at least there are opportunities for us to do that.
Right. And you know, it doesn't always have such a positive, you know, there are some policymakers that are not very good. You know, unfortunately, I think many of us have called certain offices in Washington and never gotten a call back, or never gotten the sense that we're being heard. But I think we still need to do it. I think we need to be able to say, we put in X number of thousands of calls to this person in Congress, and you know, they have undoubtedly heard what we have to say. So it really is a wonderful opportunity. The other thing I might suggest to you, Celine, you have a cell phone number now. Send them, you know, a 2-word text and say, thank you so much for talking to me. Because one of the things is that nobody, you know, most policymakers are not getting rich doing what they're doing. And so it's their time and their attention. And I think we always want to be acknowledging that, just as you would with anybody that you were doing business with. And they love to get thanked. I mean, one of the things I'm going to suggest to you all is that if you have a meeting with a legislator or somebody on your Metro Council, that you drop them a handwritten thank you note. They love it. And, you know, those things are very rare in these days and times. So they, you know, they appreciate that. So other things that we can do is to work with the media. know who your friends are at the Courier Journal or at the Kentucky Health News or at your local little community papers, because the more that you create a buzz about your issues, the more that you can point out how serious a problem it is, and the more media coverage you get. So you can't buy that kind of media coverage. None of us have that kind of money, but you can create it by showing up at meetings, by speaking out, by having good stories. And you want to rally other people to support you. So if the word spreads throughout the grassroots community that you have a coalition that you're building some support. Look at the Black Lives Matter and look at the racial injustice kinds of meetings, protests, and so forth, and how it spread throughout the community. Gather allies to work in coalitions, even people that don't know that they're interested in your issue, get them convinced that they are interested and get their help. So the business community could be very powerful. So what's the hook to get the business community engaged in your Housing is Health campaigns? Let's talk about that. Let's figure out what that hook can be, because the business community carries a lot of weight with policymakers. You know, they have money, they pay taxes, they hire people. All of those things are very important to policymakers. So we need to, the other is the faith community. When we did our big campaign to get rid of discrimination in insurance coverage for people with mental illness and substance use disorders, some of our most powerful allies were the Catholic Conference and the Council of Churches and the Council of Jewish Women. And some of the legislators said to me, well, I heard from my minister about this. You know, what's the deal? You know, what's the connection here? And I said, this is a social justice issue. This is discrimination on the part of insurance companies against people that happen to have a brain disorder called a mental illness or substance use disorder. And they're speaking out against that injustice, against that discrimination. And they carry a lot of weight, particularly in a number of communities. And understand that it's about policy. I'm going to talk to you about playing the politics part of it. But it's basically, you know, housing is not a Democratic or Republican issue. It's a people issue. And even though you may be of a different party than the majority of people that you're working with, don't let it get real political if you can avoid it. It's really about the policy. Next, Angela. Thank you. So we're going to talk about the process, and we're going to talk about how you identify those policymakers. It's helpful to have some goals. So in the long run, you want housing to look like X, but it may be that you're going to have to set some shorter term goals so that you feel like you're making some progress. And it may be that you need to click off a few things to get it out of the way before you can get to your long-term goal. Helpful to know the time frame. So again, with the legislature, you know when they meet. With Metro Council, you know what their budget cycle is if you're working with the budget. So don't be a Johnny-come-lately where you get there too late and they've already made those decisions. You really need to be on top of that time frame. Again, working, you know, the more people you can get to be on your side and to speak up. Particularly in Frankfurt, we play a lot of defense. I think Emily and Angela and I would tell you stories about some of our biggest wins in this past session were killing bad bills. And you don't get a lot of PR for that. You know, it doesn't make the headlines very often. But in terms of protecting the lives of Kentuckians, we feel like some of our best work was in really batting down some really bad legislation. And sometimes you do that with a frontal attack. Very often you work behind the scenes to make sure that the bill doesn't get called, or that they don't have enough votes in the committee to get it passed. You can do it very quietly sometimes, but you know, remember to play defense and remember that it's really about relationships. If you make that contact, Celine, I'm going to use you as an example with David James, and he never hears from you again, you know, that's kind of a, you know, a fly in the ointment kind of thing. So you have an opportunity to have a working relationship with him. And I know you'll want to do that. And of course, you're already following through because he's followed through, right? By inviting you to something. So you want to show up and do your part to be just as prepared for that next meeting as you were when you called him. So you want to do your homework so that you're building your part of the relationship. Does that make sense? Okay, next, Angela. So one of the most powerful statements you can make to particularly elected official is, I am your constituent, meaning I live in the district that you represent and I vote. Everybody who holds an office right now typically wants to either be reelected to that office or wants to be elected to a different office. So being a voter, a constituent and a voter is very powerful. I always say to people, you know, most of the legislators know me because I've been going up there since 1978, but I can only vote for one House member and one Senate member in the General Assembly. I don't have the power that you all have as constituents. You also, and this is something as CHWs, you can also make a connection with a policymaker in terms of where you work. So if you're working at Shawnee Christian Mission, Celine, and you know that they're serving people from 2 or 3 of the Metro Council districts, let's say, you can make a contact not just with the one that represents you in terms of where you live, but with those other members of Metro Council by saying, I work at an agency and we serve your constituents. So I'd like to talk to you about some of the problems that they're having. Do you make a connection that way? You need to figure out how you identify your policymakers. The Legislative Research Commission has a very active website, and that link is on here later on. You can actually type in your home address and a little arrow will come down and you can click on it and the web page for your House member and your Senate member will show up. I will warn you that the pictures that are on there are sometimes 20 or 30 years old, so you may not recognize your policymaker as they look now. So figure out how to make connections. They all have a website through the Legislative Research Commission. Most of them have their home or business phone numbers listed. And remember that it's a process, not a one-time deal. Next, Angela. So really important, how do you make your case? In the old days, 15 years ago or so, KBH used to do what we called policy briefs, and they were really extremely well done. We did them on raising the cigarette excise tax. We did them on expanding Medicaid, and they were 10 or 12 page layouts with graphs and pictures and text and so forth, and we would send them to all the legislators. We don't do that anymore because what we have found is that legislators typically don't have time to read very much. So you need to think about what your topic is and how you're going to put it on one page with your talking points. So I'm going to suggest to you that you use bullets, that you leave lots of white space. If you have an illustration or a graph, that it be small but very clear. If you can afford color to pop something or to pop certain words out, you know, I think that's helpful. Do it at a 6th grade reading level. And I'm not saying that policymakers are not educated or they're only educated at a 6th grade reading level, but we have found that in terms of reading quickly and getting the gist of what you are saying to them, 6th grade really captures it. So think about what you're handing them. If you hand them a 10-page thing of all your research, it'll never get read. Now, if they have staff, which is not true in Frankfurt, and I don't know about Metro Council, I think they have some staff, they may say to a staff person, you know, read this and figure it out. But you want to be sure that you've highlighted those bullet points. What's the problem? What you think the solution is? What are 1 or 2 facts about it? We also use scripts, meaning that we tell people what we think they ought to say. We use it when we're suggesting that they call the message line in Frankfurt. So there's a 1-800 number, 372-7181, and we will send out action alerts and we'll say, House Bill 123, please call the message line 800-372-7181 message to go to, and we'll say Health and Welfare Committee, Senate Health and Welfare Committee, your message, and we give them a 2-line message. And then we may have some explanation to remind them of what the bill's about. But we want our message to be consistent as it's heard by the policymakers. And usually the switchboard only has time to write down a very brief message. Every one of those calls to that message line generates what they call a green slip that goes to the legislator's office. So it's really important to generate, that's where volume really helps, to generate a lot of calls. But you want to be consistent. When you have testimony at Metro Council, and I've been involved in that sometimes, really important, I think, for speakers to get coordinated, at least that the basic message is the same from speaker to speaker to speaker. So you may have a different set of data, or you may have a different hit on the problem, but the solution part of it really ought to be as consistent as possible. If you're going to leave behind your talking points, make sure you have your contact information on it. I can't tell you how many times I've been in a legislator's office at the end of a busy day, and they're kind of cleaning up their desk, and they'll pick up a beautifully done 2-page something or other, and they'll say, I don't remember who gave me this, and there's no contact information on it. So you want to be sure that that person that you've gone to see, that you've done all that good work for, knows how to get in touch with you, knows the group that you're connected with. You know, I'm here for Advocacy Action Network, or I'm here for Thrive Kentucky. Here's my name and here's my contact information. Next, Angela. So I'm big on coalitions. They sometimes call me the grandma of coalitions, because I think the more people that you can gather together with the same message, the more powerful you are. So again, Thrive Kentucky is a good example of a fairly informal coalition of KVH and our partners around what we're calling community safety net services. You also can have very formal coalitions. I run a mental health coalition that's 38 years old, that has bylaws and has you know, officers and has dues and so forth. And we used it because we were bringing together 80 organizations that really sometimes fought with each other. And it was really helpful to have that kind of formal infrastructure. And, you know, I'm proud of the fact that we've survived 38 years and are known in Frankfurt as coming together with one voice around mental health issues. You can also have coalitions around a single issue. We have a little coalition working right now on what we call mental health parity. We're still fighting with insurers because they still discriminate against payment for mental health services. And so the Psychological Association and the Psychiatric Association and the NAMI groups are going to work just on that one issue in the legislature. And again, you want to include unlikely allies. Think about your faith community, think about your business community, think about your veterans groups. Those are the kinds of groups that really get the attention of legislators. When we were working on healthcare reform, we worked with the Community Farm Alliance, and it was hugely helpful to have these local farmers in a state as agricultural and rural as Kentucky, to have them with us on these health reforms. You want to be sure that you can focus on those ultimate decision makers, figure out who can influence them and connect you with them. And then you want to build a buzz. And this is where social media, people like Angela who do social media, I have Marcy Timmerman who does it on the mental health side, does a Facebook page, does some tweets, you know, follows what other people have out there. A lot of the legislators are using Twitter. So if you're not, you can follow many of the legislators in Frankfurt on their Twitter accounts, and you can find out all kinds of stuff about them in terms of what their activities are and so forth. It gives you a connection, which is really helpful. And you want to keep that buzz going through the media and through your general public support. Next, Angela. So you want to be inclusive. You want to be sure you have the facts. You want to get people pulling in the same direction. Sometimes you have turf battles. You have people that think that it ought to go a different way or be solved a different way. Try to solve those before you get in front of a legislative committee or in front of the Metro Council. If they sense that there are people fighting about the issue itself before it ever gets to them, they will walk away from it. They really don't want to be involved in these internal battles between, different kinds of professionals or different ways of solving a problem. So another purpose of coalitions is to make sure you can kind of settle those battles before you get out in public. Make sure that people are at the center of your activity, of your advocacy. It's always about the people and about the people's voices, and empower others to speak up. At this point, I very seldom testify in Frankfurt unless it's about a fairly technical issue. I want people to come to the table to tell their story. I want them to come and tell how this issue has impacted their lives and why it needs to be fixed. Next, Angela. So I would love to have 10,000 people out in front of Frankfurt Capitol, all aiming for in the same direction. So think big. Think in terms of, I always say I can't find a tent that's big enough to put everybody under that I think needs to be under it, working on people issues. And people are not always at the top of the priority list in Frankfurt, or maybe even at the Metro Council level. If you think about the budget document, most of the budget goes for infrastructure and some of those kinds of things, but they give away tax breaks to wealthy corporations. I don't think that's putting people first. So we need coalitions and working partnerships that keep the people as the focus. Next, Angela. So putting a face on the problem. When we did the 2000 assault on the insurance companies to get them to quit discriminating against people with mental illness, that was the first year that we ever had literally a consumer of mental health services come to Frankfurt and tell her story. And I was nervous about it. I'll be frank with you. Legislators are sometimes rude. They sometimes ask, I think, really awful questions. Sometimes you go up there and you wait and you don't get a chance to testify. I mean, it's a very anxiety kind of place. And so we had somebody who was the perfect story. She was a Jefferson County teacher who on 3 occasions had been put out of the hospital because her insurance company said you could only be in the hospital for 5 days, no matter what the doctor says and no matter how serious your diagnosis is. And so she ended up losing her job and going on disability and almost lost her family. And when I met her right before the session started, she was well on the road to recovery, really struggling with bipolar disorder. And she was a magnificent speaker. She was very bright and a striking figure, 6 feet tall, blonde. Our color in Frankfurt is red, so I'm wearing red today. So she was a striking figure in red. And she was willing to come to Frankfurt and bare her soul, tell her story about what she had been through with getting an accurate diagnosis of a bipolar disorder and being put out of the hospital and because of the insurance restraints. And so I worked with her and with her permission with her therapist because I didn't want to put her at risk of negatively affecting her recovery. And so she came to Frankfurt, and when she testified in the Banking and Insurance Committee, you could have heard a pin drop. If you've ever watched the legislative committee meetings, they, people are walking around and talking to each other and getting coffee, and half of them aren't paying any attention. But when Molly came and told her story, you could tell that people were just fixated on this story. And the insurance companies came and told their stuff about, this was terrible legislation. And if it passed, insurance premiums would go up a bazillion points and so forth. And we got the bill out of committee, which nobody thought we could do. And then we got it passed on the floor of the House. And Molly continued to be the face of that problem. And when we finally got to the Senate for a final vote, the Senate was not going to call the bill for a vote. And she had been emailing Senator Dan Kelly, who was at that time the majority floor leader in the Senate. And she emailed him finally right before the last day of the session. And she said, I thought a democracy was about the voice of the people. And you have heard from the people all through this session. So why are you not voting on this bill? And they voted on the bill the very next day. And of course, she was, our heroine through all of this. So think about your clients. Think about the stories that they're telling. And one of the things we work with in Kentucky Voices for Health and through the Thrive Kentucky is helping people to tell their stories if they're willing to do that. So Angela, if you would put Ryan's contact information, or Emily's put something up now about story banking. So we collect those stories. We have a wonderful guy who will video. Someone will help them through that process, or will audio tape it. We get people's permission, obviously, to share that with media. That's one of the things that Angela does. So we don't want to force anybody. We don't want to out somebody who's not quite ready to tell their story. But if you know people that are suffering from any number of situations that you're trying to deal with, and they're willing to step forward. And if you notice, the media coverage now is always about those stories. It used to be that when you got a story in the Courier Journal or the Herald Leader or whatever, it was pretty factual stuff. Now it's the factual stuff always coupled with at least one, if not two, pictures and interviews with people who are facing that problem right now. So one of the things that we struggle with in all of our coalitions is making sure that we have new faces, if you will, that can tell their stories and that are available, because once they've talked to somebody, then the next time it comes up, they would really like to talk to somebody else. Are there some questions there, Angela?
Yeah, Julie Horn Easley has asked how my chat just went crazy, how we compensate for storytelling so that folks don't feel exploited. And I can answer that. We do give gift cards to folks who are willing to tell their stories and meet with Ryan. The amounts on that vary. Emily, I think it's $50 now. Is that correct?
Yeah, it's $50. Of course, if somebody needs help with transportation, we could provide that too. But I think more than anything, this is different than a media story that's being sort of used by the media for their own agenda, or just because it's a feel-good story or whatever it might be. We really are helping someone to share their story so that we can advocate for the things that they need. So we do this when we're trying to protect Medicaid or expand coverage options. The Housing for Health campaign is a perfect opportunity, because a lot of people don't, really connect the two. Unfortunately, they seem very connected, but that you need affordable and also safe quality housing in order to be healthy. And so if we're going to start talking with legislators about housing as health and wanting to push for a policy, then these stories help us to build that support, public support for that.
Yeah. So lots of ways. And what I think is helpful when you're talking to a legislator is putting the data, in this neighborhood, there are, 0 housing units available, and here's a typical story that we hear in that neighborhood. So you're putting together that kind of personal story with the data. And again, the most powerful voices are the local constituents talking to their policymaker. Next, Angela.
We have another question from Celine. How do you process or cope with advocacy defeats, especially when you feel like you have a strong campaign or approach to the specific advocacy effort?
With a defeat, is that the
Yes.
word? It's
It's a good
not a
question.
vocabulary. Oh, I've had some very bitter defeats. Your passion carries you through is all I can say. We had a bill called Tim's Law to try to get court-ordered outpatient treatment for people with serious, severe mental illness, actually. And we were defeated 4 consecutive legislative sessions. We had rallies, we had people up there, people testified, and each time we could not get a vote in the Senate, we would get it out of the House. So we changed tactics, and we started it in the Senate with a very powerful Senate sponsor. So sometimes a defeat teaches you something, and when it happens over several times, you have to kind of get with your people and say, you know, how can we change things around and do things a little bit differently? So we got a very strong Senate sponsor and started it in the Senate. We made a couple of tweaks to the bill and so forth, and we actually got it passed that year. So a defeat can teach you some things that, you know, or have you re-examine and maybe change your strategy. I will tell you that that particular bill, we were actually preparing for a huge celebration, that we were going to have a ceremonial signing with the governor and have a huge celebration, 5 years of getting a bill passed. And the bill sponsor texted me one night and said, the governor has just vetoed the bill, which came as a complete and utter shock. Felt like somebody had kicked me in the gut, quite frankly. And my first thought was, well, besides cussing a little bit, well, we're dead for the next couple of years because this is the first year that this governor is in office, and so he's going to veto it every year. And I thought, I'm not sure I can wait, you know, or another 3 years and then maybe a new governor. And the bill sponsor texted me after a while and said, we're going to fight it. And I don't know that I've ever seen the mental health community more energized than they were in fighting that veto, because they really took it personally. It was a stupid veto. It made no sense. And we had worked for 5 years on this bill, and we were not going to lose it. So we generated over the next 2 days probably 1,000 calls to the message line. And we had 50 or 60 people in red. When they came back into session, we had the mother and sister of Tim, who the bill was named for, who had passed away, standing at the floor of the Senate and meeting every senator who came in, because I wanted them to know that Tim was a real live person and that there were family members and people that were affected by these problems. And the Senate went in and overrode the veto of their Republican governor, and then the House did the same thing. So all I can say is, after a defeat, you have the most delicious celebrations afterwards. And we did not invite the governor to our celebration, I want to point out. So I would say you have to have faith in the system and in your cause. And one of the things that legislators have confided in me, which is helpful to know, is I've had more than one legislator say to me, you know, I don't pay too much attention until I've heard the same issue 2 or 3 times. And then I know they're really serious about it. So if you're a one-shot person and you're going to come and do your legislation and it fails and you go away, you are in effect saying to the policymakers, yeah, it wasn't that important. And I just don't believe that. I don't think that we get our juices going, and, you know, we may have taken a wrong approach in trying to solve the problem, but the problem is still there. The problem is important. And again, what a defeat can teach you is, you know, let's rethink how we're going to go about solving this. But we're not, the problem hasn't gone away, and we're not going to go away.
Yeah, I'll just add to that, Sheila. You know, this is often kind of a puzzle, and sometimes the pieces are shifting as other things change. And so you're putting pieces together. You may not have the puzzle fully, you know, finished, but
Right.
You are getting pieces in place. Even, you know, when we were working earlier this year to defeat House Bill 1, which was the House leadership's priority bill, and it was their second attempt to cut the safety net and to impose lifetime bans for people, we had a lot of advocates on our side. We had a lot of people who were helping us to really raise, a lot of noise. And we were meeting with legislators, and those meetings were very different behind closed doors than whenever we testified in front of a committee. And when we testified, we had about 10 people testifying in opposition to this bill. Nobody was testifying for the bill. And yet the House committee, every single Republican voted for the bill because it was House leadership's bill. But then they went to their Senate colleagues very quietly. None of this happened publicly. And they asked their Senate colleagues to kill the bill. So it felt like a defeat when we left that committee that day after they all voted in favor of this bill. But ultimately, we were able to kill the bill. And so it's just not as simple as that. But don't think that you're failing just because you may not get a vote at a particular meeting, like Sheila was saying.
Well, the other thing that happens is that I have lost bills that never had a no vote. I had a bill that was just needed to be called off the consent calendar one year, and it had passed the Senate with no votes, passed the House committee with no votes, and all they had to do was to say, I moved all of the bills on the consent calendar pass, and we would have been done. And they adjourned the session early without calling the consent calendar. So sometimes bad things happen. They adjourned this session actually without using all their legislative days. So I had bills that should have passed, and because of the coronavirus, never got heard in committees because they canceled the committee meeting. I was supposed to testify on one of those bills the day after they closed down the Capitol, and they just, instead of trying to figure out how to get me there or allow me to testify, they just canceled the committee meeting, and my bill died. So there are things that happen sometimes. You can't take some of this personally, I guess is my other rule of thumb. Sometimes the defeat is not something that has to do with your issue, which is hard to take. It still is a defeat, but don't assume that everything has to do with your particular issue. Sometimes it doesn't.
Well, and Sheila, it reminds me that on the last day of session, there was a bill, Senate Bill 136. There was a committee substitute, which means that they pretty much take everything or big pieces of the bill out and they substitute other language. And House leadership, again, substituted language in this bill that would make CHWs Medicaid billable, which is something we've been advocating for years, ever since the Affordable Care Act made that possible. And it passed the House and went back to the Senate and never got a vote because things were down to the wire and simply they ran out of time. But there was a lot of support for it. So this is something that we would love to work with you all on for the next session.
Right. Yeah, and that work got done. I got a call from a friendly legislator, and I called Emily, and we worked on language, on our cell phones because we couldn't be up in Frankfurt, and we worked out the language and got it in there. And then it was really disappointing that the Senate just, ran out of time and couldn't take it up. So you have to be tough. Thick-skinned helps a little bit. Next, yeah. So, rallies are helpful, press conferences. I always say to people, if you could get 100 people or more, have a rally in the rotunda. If you've got 25 people or so, schedule a little press conference. You'll get press there during the session and get some coverage. Send out action alerts, however you want to do that, to your groups, and be real specific about what you want them to do. Use your social media. A lot of people are communicating via Facebook and Twitter with their legislators. Some people are scheduling meetings and calls with their legislator on social media. They love personal visits, or they used to. I don't know how open, quite frankly, the Capitol will be in 2021. It's a short session, a 30-day session. And it still is unclear to me. Right now, in the interim session, they're having committee meetings and we can't be there. We can only watch online, which is not democracy, quite frankly. You have to be prepared with your testimony. I think it's helpful to have, we have our Red for Mental Health, or to have a slogan that they kind of recognize. And again, utilize the media to keep your story alive. Next, Angela. So one of the things you want to do is to point out, here's what's happening now and here's what needs to be changed. And I do think that op-eds and letters to the editor can be helpful. I don't think they're as powerful, quite frankly, as they used to be in kind of influencing legislators, but they do get the attention of others in the community who may want to join you in your fight. Don't forget the small town weekly community papers, and there are some here in the metro area, like St. Matthews has the Village Voice and so forth. And use consistent messaging when you're talking to your legislators. I always say to people, if you're reaching out to your legislator for the first time, put the subject line, I am your constituent. And the first thing you put is, you know, hello, my name is, and I live at, so that they know that you live in their district. And I would like to talk to you about this problem, and write a couple of sentences. Do not send them, you know, an email that is long, and they can't get through. But you want to make that connection with them that you are a constituent. Next, Angela. So just remember that all politics are local. So think about who your local representatives and senators are from the Louisville area or from whatever area. And be sure that they know where you stand on some of these issues that are statewide issues. Same thing with your Metro Council. Again, you can make that connection in terms of where you live, but also in terms of where you work and the constituents that you serve. Next, please. So the tulips are beautiful. I don't know if they're more beautiful than the people, but they are a mark of our legislature. I'm going to go through this very quickly in terms of time and point out some of the things that you need to know most. Next, Angela. So you've identified that you need something to change. It's helpful if you're doing something to see who's addressed it in the past. So you have a housing issue, you can go on the Legislative Research Commission website and you can search what they call the legislative record, which is the listing for that session of all the bills. They have an index, and housing is one of those indexes. And you could very quickly, it would be a great thing for an intern or a student to do. And you could go, say, for the last 5 years and look up housing and see who the legislators are who have had any bills around housing. And see if that's somebody that you might want to talk to if they're still in the legislature about what you would like to do. So you need to be strategic about picking a sponsor. The Republicans have what they call a supermajority in both the House and the Senate. So most people would say, well, it would make sense to have a Republican sponsor, and in many cases it would. There are some Democrats that work very well across the aisle. Emily's saying yes, also connect with the Homeless and Housing Coalition of Kentucky, because they will very often have that legislative history and be able to tell you who they've worked with on housing issues. So you want to work very closely with your sponsor. Some legislators are very bad about saying, yeah, I'll sponsor your bill, and they get it filed and then they never do anything else with it. So you really want to be sure that you've got somebody who's willing to work the bill once it's filed. Next, please. So again, our issues are not partisan. Again, access to health care, mental health, housing, food security. Those are not DNR issues, but the process is political. So the importance of the majority power is, the party is that they really hold the power. So they set all of the committee chairs are Republicans. The majority of every committee are Republicans. The leadership of every chamber are Republicans. So they will pretty much decide what things are going to move along and what things are not. That doesn't mean that you can't work with your bill sponsor and with your committee members and get things moving along. Legislating public policy is not always logical and rational. I have a hard time with that as a psychologist, but I keep trying to remind myself that it doesn't always immediately make sense. Eventually it does. And then I love, those who love sausage and the law should watch Neither Being Made. You can have good sausage, depending if you put good stuff in, and you can have good law, but the process is messy sometimes, and I think you have to be prepared for that. Next, Angela. So your bill can only be introduced when they're in session. So we're going to go into session on January 5th. And if you have a bill, you want to have it ready. Only a legislator can get a bill drafted, and it's drafted by the Legislative Research Commission staff. And they usually have it drafted by the committee that that the bill would likely go to. And remember from your civics class that it only becomes law if it passes both the House and the Senate in the same form, and is either signed by the governor or is not vetoed. I put this in here about the process is the same, whether the bill is only one sentence long or 300 pages long, because people say to me all the time, Sheila, this ought to be easy. This is a really short bill. And I'm like, it doesn't matter if it's a short bill or a long bill. You still have to go through the committee and the House or the Senate, the full House or Senate. You still have to come over to the other side and do that same process. You have to be sure that it's not amended over there, so you have the same bill was passed by both, and then you've got to work to make sure that it's not vetoed by the governor. So several hundred pages may be harder to explain. Sometimes they're very leery of a single sentence. They're like, what are you trying to pull here? You know, what's the real story behind this? So sometimes you end up doing as much explaining about a single sentence bill as a big bill. Next, please. So we meet every year beginning in January. We meet on the first Tuesday after the first Monday. So think about that. Typically we do a budget in the 60-day session. So we should have done a 2-year budget in 2020 for the first time in the history of the General Assembly. They did a 1-year budget, and that was because of COVID. They were so afraid of the economic impact of COVID and the lack of taxes and so forth. And I think very wisely only did a 1-year budget. So for the first time, we're going to go into a 30-day session, which is a really short session to get things done. And we're going to have to do a budget in that session. Sometimes we have a special session, which only the governor can call, and hopefully we won't have any of those, although there was some talk that we might have one this fall if the revenues fell below a certain percentage of what's in the budget. Next, Angela. So this is really important. Your sponsor determines what chamber your bill is introduced in. So if you pick Tom Birch, who is a representative here in Jefferson County, to be your sponsor, he's going to introduce the bill in the House because he's a House member. So that bill is going to have an HB number, a House bill number, and it's going to keep that number no matter where it is in the process. If you pick Julie Rocky Adams as a senator here in Jefferson County to file your bill in the Senate, it's going to have an SB number, and that number is going to stay with it no matter what. So people get confused. If we're following House Bill 123 and it passes the House, and I send out an action alert and I say, call the members of the Senate Banking and Insurance Committee and tell them to pass House Bill 123, people are like, oh no, that can't be right because we're in the Senate. It must be Senate Bill 123. And it may turn out that Senate Bill 123 is about pig farming, which is probably not something that we want to be advocating about. We don't have a vested interest one way or the other. So just remember, and it's important to know the bill number. If you call the message line or you talk to a legislator and say, well, I've got a bill on health, you know, in a short session, they will have 750, 800 pieces of legislation. There may be 50 bills that have to do, or 60 bills that have to do with health. So really important that you know the bill number. Again,
I have a really good question from the chat.
Yeah.
If a bill passes the House and goes to the Senate and is amended, does it have to go back to the House?
Yes. Hold on, I'm going to get to that in just 1 minute. That's a great question, and you are right. It has to go back and get fixed. So again, the majority party One of the things you don't want to do, and the first time I ever went to Frankfurt to testify in 1978, I was such a novice, I didn't know what I was doing. I had great testimony. I had no idea who was on the committee. I had never spoken to them before. And everybody else who testified against my bill were from the districts of the people on the committee. They all knew them by first name. They were all talking to them. Guess what happened to my bill? It was a terrible vote. I mean, I don't think we even had one yes vote. And I learned that all politics are local. You really have to work your bill before you get it to committee, no matter how articulate and wonderful your testimony is. You have to be sure that leadership is ready to have your bill heard on the floor of the chamber. And then if you have amendments or questions, you're sitting up in the gallery. I always wish I had a can with a wire to my sponsor's ears so I could say, here's what you need to say about, that question or so forth. But you want to be prepared to fight off any amendments that are filed if they're bad. Next, Angela.
And that's 11:21, and I have not been a very good timekeeper.
So one of the Schuster rules is celebrate everything good that happens to your bill. So you have little celebrations if you get to a good committee. You celebrate when it passes, celebrate when it passes out of the House or the Senate. So you have to repeat the process in the other. And here's what happens. If we have House Bill 123 and it gets over to the Senate changes it. We now have two versions of House Bill 123, and you can't have law. So the Senate's going to send the bill back to the House, and they're going to say, we've improved your bill, so you need to just accept or concur with our changes. Hardly ever does that happen because remember the bill started in the House and they think that their version is the best. So typically the House will say no or hell no, and we're not going to concur, we're not going to agree. We're going to send it back to you and you need to recede or back off from your changes. And again, the Senate's going to say, oh no, we made it better. So you're still at this, standoff. At that point, the House and Senate leadership will appoint members to what they call a conference committee. So it'll be D's and R's, it'll be people who are for the bill and people who are against the bill. And here's where it gets the scariest for us advocates. They go behind closed doors. So it's not a public process. And they can actually change that bill in any way they want. I mean, it is really a scary time. So my job as a lobbyist and advocate is to work with my people on that committee that are with me to say, here's some bottom lines. We can't accept it if they do X, Y, and Z. And most of the time, what comes out of a conference committee is acceptable. Only on one time in all the years I've been up there was it so bad that I told our sponsors to not accept it, and we voted the bill down. We lost the bill because they had put such terrible changes in it. But most of the time, the conference committee comes out with a report, the House and Senate agree on that version, and then that version goes to the governor's office and is approved or vetoed. And then you have a great big celebration. And all along the way, you're trying to thank people that have helped you. Committee votes, you get back to people, obviously your sponsors and so forth. One of the things you want to do is to get co-sponsors to sign on to your bill when it's introduced. So you have a Republican sponsor and then you try to get some of the Democrats and some of the Republicans in the chamber, and it shows support, bipartisan support. And the more co-sponsors you have, very often, it can help. People look at it and say, oh, we had a bill on nurse practitioners, and we had 46 co-sponsors, about evenly divided between the D's and the R's. And it helped. It got the attention of leadership to say, oh, we got all these people that have already committed that this is a good bill. Next. So this is where you get into the executive branch, because now we have the bill and then we have to implement it. And the implementation is the regulation process that we talked about earlier. And that's the work of the executive branch. So in our system of checks and balances, we have legislative, executive, and then obviously we also have judicial. And we saw the judicial branch come in over the governor's executive orders around COVID, right? So they were not legislative orders. The legislature was kind of out of it. That was an executive branch order that was challenged and taken over to the judicial branch, and that's where the checks and balances were. So the regulations job really is to cross the T's and dot the I's. So I always say that passing the bill is like framing a house, but you can't live in it. And the regulations put in the flooring and the electricity and the plumbing and so forth. So you can work through that process as we described earlier. And you can sometimes get to people in the executive branch before the regulation is ever put out there in public and influence the regulation before it's published. Yeah, Emily says the advocates have to make sure the house is being maintained. People go back and change those regs, and sometimes it really changes the way that the legislation is implemented. So again, keeping an eye on what's happening over there from the executive branch is just really, really important. Next, Angela. So are we advocating or lobbying? And I think the important thing for you all is you're advocating. I'm a lobbyist. I'm required to register with the Legislative Ethics Commission because I am paid to be in touch with legislators and to try to influence them about legislation. You all are citizen advocates. You're not being paid to get a bill passed, and you are able to talk with legislators as citizen advocates. My poor mom was a social worker, and she was always so proud of me being a doctoral level psychologist. And then when I told her I was a lobbyist, you know, she was like disappointed because they have such a bad reputation. I still think of myself much more as an advocate, but I do get paid for talking with legislators. The Alliance for Justice is an excellent resource. And if your agency has some questions, I know that some agencies, because of federal funding, may be prohibited from raising any issues around specific legislation, but Alliance for Justice is an excellent resource. And they're available, I think, Emily, even with phone calls and so forth, aren't they? They'll do workshops for you.
Yeah, I've had a call with them, and they will do webinars too.
Yeah. Next. So be sure you know who your senator and representative are. You can go to that website, type in your home address, find your legislator. Like Celine did with David James, you know, contact them on their cell phone or call them at home. When they are in session, that message line is probably the most direct and most powerful. And again, volume helps, but you know, Kentucky's a small state when you think about volume. So legislators will say to me, boy, this is a hot issue. I've just, you know, my phone's been burning up about this. And I'll say, well, how many calls did you get? And they'll say, oh, I bet I got 15 or 20 calls. I mean, we're not talking about generating thousands of calls, folks. We've done postcard campaigns where if a legislator gets 10 postcards from 10 constituents, they're impressed. So, you know, again, making sure you touch base with all of the legislators is probably more important than trying to generate 10,000 calls to a single one. You can follow the action. You can, you don't ever have to go to Frankfurt, although I think it's helpful to do it, but you can sit in your pajamas with your favorite beverage in your hand, follow all the action. You can watch it on KET. They tape the committee meetings and the meetings of the House and Senate during the session, and they're online. You can watch them later. Next, Angela. So you're an advocate because you vote and you speak out, and it really is important that you vote. Legislators will check. I've had legislators say, well, your postcards were pretty good this year, Sheila. You know, 6 out of the 10 were really from my constituents, but I checked and only 3 of them are registered voters. So they do check that. And why is it important? Because they want you to vote for them. Again, to run again for that office or to run for something else. They also will check to see if you're a regular voter. Now, I don't want you to be scared that they're in the voting booth with you because they don't know how you voted, but they will check. You know, if you've registered, but you haven't voted since you registered, or you've only voted once every 4 times that you could vote, you're less powerful than somebody who is a regular voter. So I think we cannot, you know, and I think of John Lewis's memory, we have to do everything we can to make sure that people get registered, people understand the power of the vote. Probably the most effective way to raise your voice, actually. Next, Angela. So just a reminder that this is an important election year. 65 of the 100 House seats will be on the ballot in November, and 12 of the 19 possible seats, the half the Senate runs every 2 years. So there's only 19 of the 38 that were potentially on the ballot. 12 of them are actually on the ballot. So really, really important. You can go to the Secretary of State website to see the candidate filings. I'm actually working on a list by county that will show you all the races in November and who the candidates are, and we will, KVH probably will post that on their website as well. The other thing you can do, and if you really want to get in with your legislator or with somebody who you think ought to get elected, get active. Call them up and say, what can I do? Walking a district, distributing flyers, you know, having a little conference call or Zoom meeting, whatever you can do to introduce that candidate to other people that live in the district that are friends of yours. You will have a friend forever, I'm telling you. And again, it doesn't take a whole lot to get on that list to be helpful, particularly now during the COVID. You know, people are not able to go to church picnics and gatherings and fairs and places where they would typically meet people. So they're really anxious to have an opportunity. And if you have some way to introduce them to your group, they will take you up on it. Certainly, we need to remember that elections have consequences. So you can get registered until, I think it's October 10th. Check that date and be sure that you get people out to vote. Next, Angela.
We're at 11:52.
Okay. Oop. All right. So stay informed and connected. You can watch on KET. Angela and Emily send out weekly updates from Kentucky Voices for Health, the Advocacy Action Network, any of our Thrive Kentucky partners. I would think, Celine, that you all want to be real active with you mentioned the Homeless Coalition here in Louisville, and also the statewide Homeless and Housing Coalition. They will have stuff on their website. They'll have meetings and so forth. Be positive, be polite, but do not hesitate to be persistent. You just really have to hang in there. Remind yourself to say thank you. Reach out and educate others and believe that your voice can make a difference. I absolutely believe that it can. So my final message to you is my favorite quote from Margaret Mead. I think you all are that small group of thoughtful people. I think you can change the world and make housing as health a real reality. So I'm here to be a resource for you, as is Thrive Kentucky. And I will end with that. So here's your information about getting CE credit. And I'm sorry, did Laura want to say something?
Well, that's what I was just going to ask. Is Laura on? We have a few people listed still as Angela, so I wasn't sure if she was on the call or not.
I'm actually gonna provide the updates because Laura had to hop on another call.
Okay.
But thank you so much, Sheila, Angela, Emily. This was a wonderful presentation, and it highlights so many things that had loosely heard about, but now can understand more concretely. So I will definitely be keeping in touch with you as we continue to develop the campaign. I know that we're over time, so I'll just quickly go over the state updates from Laura. Let me just, email is not cooperating. Hold on. Okay, so Laura mentioned updates regarding certification. She said, we are working on updates for the 2021 year. We have kept track of reoccurring issues and questions, and we'll address each of those. We have a survey that will go live in the beginning of August. Please fill it out. Your feedback is important. We want to make this process better for you. And there is a webinar scheduled for August 6th covering certification, continuing education, and recertification. And then there's an update for continuing education. Advocacy 101 is the first approved CEU program. Thank you all so much.
We love being trailblazers.
Yes. And she mentions, please encourage your programs or community organizations to apply to have their trainings approved. The application is on our website. Go to ky.gov and search CHW. And then the upcoming kayak conference will qualify for CEUs. Certified CHWs may earn up to 5 credits for independent programs, which are any trainings that have not gone through our approval process. For any continuing education, please make sure to keep your documentation, certificates, agenda, etc. And then impact update, we will be getting our impact stories of success project off the ground soon. We will be asking programs to submit stories of success. This is a good time to start thinking of a story that you would like to share. This project will have made more of a programmatic focus instead of an individual CHW focus. Rahel Bass will explain more tomorrow. And then updates for kayak. The kayak conference is scheduled for September 24th via Zoom. Time frame is 9:30 a.m. to 4:30 p.m. Topics will include heart disease and stroke, motivational interviewing, ACEs and self-care, and a CHW panel discussing COVID-19. Registration goes live on August 1st. Kayak members will be $25 for the fee, and non-members will be $50. And our next CHW advisory work group meeting is tomorrow at 1:30 via Zoom. The Zoom link and meeting materials will be shared this afternoon. And that's it.
And do we have an evaluation form, Angela, or does that come out from Laura?
No, I will send out an evaluation along with the recording and the slide deck.
And I'll have some handouts to go with that I'll get to you. Yeah.
Yes, ma'am.
And you all will receive the Housing for Health report before the end of the month, which will provide some next steps for how we're moving forward.
Great. Good luck to you.
We're looking forward to it.
Yeah. I look forward to working with you.
Thank everyone.
Thank
All right, y'all
you.
have a great day.
Bye-bye.
Bye.